Good morning, how can I assist your family today?
我哋擔心爸爸，最近佢講嘢同埋理解語言有啲困難。
Has there been any recent medical history, like a stroke or head injury?
佢3個星期前中咗風。
The difficulty in speech and language comprehension you're describing could be related to aphasia, which often occurs after a stroke.
咩係失語症？佢喺醫院嘅時候完全冇事，佢可以行路、食飯同講嘢，好似中風冇發生過咁。
Aphasia is a language disorder that affects a person's ability to communicate. It can impair speaking, understanding speech, reading, and writing. Although it is rare, it is possible to have a stroke and not have any issues right away, but then develop aphasia after a week or so.
失語症唔單止影響講嘢，理解能力都會有問題，係唔係？
We'll need to assess him further to determine the type of aphasia. We can perform a comprehensive neuropsychological evaluation and a brain imaging test.
爸爸幾時可以做呢啲測試？
We will schedule the speech test as soon as possible, typically within a few days. As for the MRI and CT scan, we can arrange those tests within the next 24 to 48 hours to assess any brain damage. I will put in the order. My nurse will schedule for you when we are done here.
有冇方法可以治療失語症？
Yes, treatment usually involves speech-language therapy. The goal is to help the person recover their language skills and develop alternative ways to communicate.
恢復需要幾耐？
Recovery time varies. Some individuals experience significant improvement within the first few months, while others may need ongoing therapy for a longer period.
有冇藥物可以幫助失語症？
Currently, there are no medications specifically for aphasia. However, certain medications might be prescribed to manage underlying conditions like depression or anxiety that can occur after a stroke.
失語症會唔會自己好返？
There can be some spontaneous recovery, especially within the first 6 months after a stroke. However, structured therapy is often necessary to maximize improvement.
佢嘅情況有冇可能變得更加嚴重？
Aphasia might improve with therapy, but in some cases, it could remain stable or show minimal progress. However, ongoing support and therapy can help maintain or even enhance his ability to communicate.
佢嘅記憶會唔會有影響？
Aphasia does not directly affect memory, but if his stroke involved other areas of the brain, memory and cognition could also be impacted. We'll monitor this closely.
佢仲可以做其他活動，好似睇書同寫字。
It depends on the severity of his aphasia. Some people can recover their reading and writing abilities with therapy, while others may need to rely on alternative communication methods.
我已經問晒我要問嘅問題啦，多謝醫生。